Hello, I am Professor Eads, and today our lecture is going to be on psychosocial theories and therapies. We're going to start with talking about Sigmund Freud. Now, he is the father of psychoanalysis, and he developed a very good organized theory based around personality development. He influenced contemporary theories more than any other individual, and a lot of what he did was influenced by his childhood, especially his relationship with his mother. When we think about psychoanalytic therapies, it was the belief that all human behavior was caused and be explained. That there were repressed sexual impulses and desires that motivate the behavior that human beings have, and that personality is organized to control those impulses so that the person at the best of their ability can present what they believe is their best advantage. Repressed impulses would end up affecting a person's behavior either for good or bad throughout their whole lifetime. Within his theory, he believed that there were levels of consciousness and that all behavior of human beings had some type of meaning. With that, there were three levels of awareness. That conscious level of our perceptions and our thoughts and emotions that exist in our awareness, and an example of that is love. Your preconscious is your thoughts and emotions not currently in that person's awareness, but they can recall if some effort is put into it, like their childhood. And then you have your unconscious thoughts and feelings that motivate a person even though they are unaware of them. And make sure that you're reading this section, especially under defense mechanisms within your textbook. With level of consciousness, we think about the subconscious, which is that third piece, where thoughts or feelings in the preconscious or unconscious level of awareness exist. And then there's this idea that with Freudian slips, that individuals have some type of conscience that says, I shouldn't, but because they're not really aware of what they're doing, they end up saying it's the truth, but their filter's not working. So they've labeled this as something called the Freudian slip, where it's not really an accident or a coincidence. When we think about personality, there are components that go along with that, and one of them is the id. This is where that part of our personality is what we inherited. It's present from the time that we were born. It reflects not only our basic but also our innate desires. It expresses the pleasure that we seek, the pleasure-seeking behaviors that we have, sexual impulses and aggression. It's about that instant gratification that we need, impulsive, unthinking behavior, and it can also include that space where there's no regard for rules or social conventions. And if you think about it, if it is present with us at birth, we're not really aware that we're doing it. We just know what we need, and we need it now, and we want it so that we can feel better. And that's evident as babies cry about the things that they need, and once they get what they need and they feel content, most of the time there's an instant gratification that happens there. And because of no thought process, there are no rules or social conventions. With the superego, this is a reflection of our moral and ethical concepts and values and expectations. It's directly in opposition to the id because it's our conscience. When conflicts arise, a person will live up more to the demands of the superego, which is expected to happen. With the ego, it's a mature, adaptive behavior that allows a person to function within the world that we see today. So when anxieties arise, a person tries to find balance with the impulsivity of the id and the stringent rules of the superego and try to find like a happy medium. Freud technique took into consideration dream analysis, free association, ego defense mechanisms, and believed that there were 5 stages to psychosocial development based around oral, anal, phallic, latency and genital phases, and that they had their age ranges that went along with them. He talks about transference and countertransference, and if I cannot express this enough, you need to make sure that that definition that you do. Transference is when someone takes their emotions and feelings and things they have and they associate with you, maybe because you remind them of someone. And it could be positive or negative. And countertransference is we counteract and respond to that transference by the other individual. Psychoanalysis is about that discovering what our unconscious and repressed thoughts and feelings are, along with our conflicts. And there is to be some thought that there is wealth in receiving therapy through that dream analysis, free association, and getting an interpretation of our behavior. Harry Stack Sullivan believed in the interpersonal relationships and believed that there was an inadequate or non-satisfying link associated with these relationships that produced anxiety, which is the basis for all emotional problems. So just keep that thought in mind, because this takes a little bit off of the work that Freud had done. He believed that there were 5 life changes, and he condensed them to infancy, in which there is a prototaxic mode where they're unable to differentiate from the outside world. This happens from birth to 2 years old. There is a focus on the oral and anal zones. If the needs are met, the infant will have a sense of well-being and will have a relationship with themselves that says, good me. If those needs aren't met, then this can lead to dread and anxiety, and the infant and child may develop that link with themselves that says bad me. With mild anxiety, it helps to train children, and with extreme disapproval, they may feel as though this is a punishment and may say, not me. With Sullivan, as a child moved towards age 2 to 6, that's when language began to develop. Parataxic moods, or their experiences were connected in sequence to one another. They begin to learn to differentiate from their selves and others. That me portion of them does continue to develop with that disapproval, but along with some tenderness of that instruction from their parents. And then they learn sublimation, that unconscious, those unconscious defense mechanisms. At age 5 through 8, this is the juvenile stage in which they need their peers, their close relationships. This is syntactic mode. There's a maturity that goes along with their communication and experiences that they receive from their environment, and they learn to negotiate for their own needs. And then in the pre-adolescence, which is age 10 through 8 to 12, they begin to develop relationships with individuals of the same sex. They begin to validate what their own personal worth is. They begin to deviate away from their family relationships, and they make a major move to a syntaxic mode. With the adolescents, this is puberty to adulthood, and so they become more interested in sexual activity, special relationships, shift from same sex to those of the opposite sex or the like. And then there's a development of that strong self-esteem that they have. However, there is some space in which they may also engage in self-ridicule. When it comes to the therapeutic community or milieu, this was Sullivan's idea, that this is the space in which interactions happens amongst clients, and that becomes beneficial, especially for that interpersonal relationship and building skills, that ability to give back feedback without having the behavior that's associated with it, working cooperatively as a group. And then you'll see that a little bit more so in a hospital, although the stays are a little bit shorter. Our role as a nurse is making sure that during that time the patients are given the opportunity to be safe and protected from the clients, and to promote their ability to engage in social interaction. When Erickson comes along, Erickson is one of the foundations for a lot of what we do within the hospital. And Erickson emphasized more that aspect of personality development. And he said that there were psychosocial stages of development. So these were the stages of trust versus mistrust that happens during infancy, autonomy versus shame and doubt when they become toddlers, initiative versus guilt, industry versus inferiority, identity versus role confusion, intimacy versus isolation, generativity versus stagnation, and then ego, integrity versus despair. And if your individual has their needs met, then they will fall more to the right side of, the left side of the verses. When they start to deviate, you see them stray towards the right side, which is that mistrust, shame, guilt, inferiority. Maslow's talked about the hierarchy of needs. And so Maslow says that level 1 is a physiological need. Everyone's needs that. What good is anything that we do in life if we are not allowed to enjoy it? So everyone has to have their physiological needs met. They need food, air, water, elimination, and to be void of pain. As you move up to level 2, then you begin to have safety and security. So when you were born, everything was given to you. If you were in pain, something was going on, your parents comforted you. And then as you get that nurture, you become safe, you feel secure, you're free from fear, you're free from anxiety, free from any chaos. As you move to level 3, you begin to be aware of relationships that you have. And I guess these goes across the lifespan. Of that love and belonging and having that closeness to others. When you get to level 4, self-esteem, respect, and admiration of others happens there. And at level 5, it's that process of one realizing that they've reached their maximum potential of what their abilities are as well. That self-actualization, that I can care for my physiological needs. I can make sure that I'm safe and secure, that I'm loved and that I belong, and that I determine what my self-esteem is. And at that height, I've reached self-actualization when I recognize that I've reached my maximum potential. However, there is a portion of that we need to think about is when we think about Maslow's hierarchies, what happens when that individual does not have these needs met the way they need to be done. So when that safety is not met, that individual becomes withdrawn and isolated. They go to extreme lengths to protect themselves from danger. They are always in self-protection mode. They have an intense mistrust. And so with that individual, you have to use touch sparingly. You have to approach the relationship slowly. And you also have to make sure that you keep a daily routine. When the needs of love, affection, and belonging are met, that individual becomes very highly dependent. They can become whiny. They can become eager to please, rigid, indecisive, and compulsive. May cling to their caregivers. They can be very dependent, and you have to really use good strategies in order to engage with your client in order to get these tasks that need to be done or met accomplished. With unmet needs of recognition, there is issues as it relates to self-esteem and achievement. They become very highly self-centered, doesn't really form close relationships, nor do they have long-term relationships. They can become easily frustrated, impulsive, emotionally volatile. They may even have some jail time. They can have unmet dependency needs. The caregiver really has to do their best to kind of just adhere to the treatment plan, set limits, enforce without exceptions, and then allow for some increase of decision-making responsibility once they see an improvement in their behavior. Finally, when it comes to Maslow's, is the identifying of the predominant needs. By doing this, it allows us as nurses to understand what is the motive or the origin of that behavior, and to make those plans appropriately. And at the end, our goal is to make sure that we help the client develop appropriate patterns to help manage their daily affairs.